Coming up next on Arizona Horizon, we'll tell you about a health alliance between Arizona State University and the Mayo Clinic. And Tax Credit Tuesday is coming up. Find out how it can help your taxes and a deserving organization. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Catherine Anaya. Ted Simons is on vacation. Last-minute ballots in Arizona that normally favored Democrats favored Republicans this past election. The Arizona Capital Times reports that leads grew for some Republicans as officials counted ballots turned in at election offices and polling places at the last possible moment. Those votes usually break toward Democrats who have used get-out-the-vote campaigns to deliver ballots on behalf of voters. Consultants attribute that reversal of the trend to a last-minute push by Republican voters, many of whom held on to their votes as long as they could. Arizona State University and Mayo Clinic are joining forces to improve healthcare delivery, increase research, and open up a Mayo Clinic School of Medicine right here in Arizona. Here to tell us about that alliance is ASU President Dr. Michael Crow and Dr. Wyatt Decker, Mayo Clinic Arizona Chief Executive Officer. Gentlemen, thank you both for being here.
Thank you.
So we have this incredible collaboration, this marriage between a recognized world leader in patient care, education, research, joining forces with the nation's most innovative university. And this is a relationship that goes back many years, right?
12 years ago, we started this evolution of a relationship between a comprehensive university and a comprehensive clinic. And a lot of things have happened, and this is where we are now.
So tell me about this alliance. What exactly does it encompass?
Well, we're very excited, and this really represents an evolution of this deep and rich relationship between our two organizations. So the Mayo Clinic ASU Alliance for Healthcare is focused on three main pillars. One, in innovation and discovery, medical research, that we have over 80 faculty that are actually either have appointments or are co-recruited by both organizations. We also have a focus on education, which includes nursing education and the Mayo Clinic School of Medicine, which we believe is going to be one of the nation's most innovative schools of medicine that's opening for its first class here in Arizona in June of 2017. And then there is the whole side of practice of medicine. And we hear a lot about the cost of medicine in the United States.
Right.
We spend more per capita than almost any other industrialized nation in the world on healthcare, yet we see results as a nation that are very fragmented. So this alliance is relentlessly focused on innovations in healthcare that can actually raise the quality of care while reducing the cost of care. And that's something we've been focused on together for a long time.
Well, you're bringing the brightest minds really in the world together in one place. What makes this particular collaboration, though, so special, especially for those of us here in Arizona?
And I think the way to look at this for Arizona is that this is an opportunity to take a world-class clinic and the most innovative university in the country and bring together the skill sets and the ambitions of changing healthcare outcomes. And so what we're looking to do is to change community-level outcomes, individual-level outcomes, family-level outcomes, lower cost, and that requires us to rethink the design. We haven't brought enough talent to bear. This alliance is meant to take everything from behavioral sciences to teaching and learning, engineering, science, match that with all of the medical disciplines, all of the healthcare fields, all of the clinical practice areas, bring all of those together and then rethink the way that we do some of these things.
Well, talk to me a little bit about this vision for this national medical school that will eventually come to fruition here in Arizona. What does it mean exactly when you say that you're really preparing the physician of the future?
Absolutely. So the idea is that medical education for medical students has not had a substantial improvement or upgrade in over 100 years. It's always consisted of 2 preclinical years and 2 clinical years. There have been some modifications over time, but we think it's time for a dramatic reboot. And so in collaboration with ASU, we've implemented an entire curriculum around a field that we're helping to create together called the science of healthcare delivery. So imagine medical students that in addition to being taught how to diagnose and treat diseases, they're also taught the science of understanding, measuring, and improving the healthcare system that they're in.
And this curriculum is already getting wide acclaim for what it offers. How does this training and education differ from anywhere else?
It is this integrated way that we're advancing the idea of this school of healthcare delivery and the medical school together. So the difference is, imagine, you have to put into your mind this notion that while physicians are fantastically trained, they're also individuals who are picked because of their significant intellects, their significant capabilities, their significant abilities to learn. What we're doing is we're, in a sense, upgrading their learning environment by several levels to make them not just scientists and physicians and thinkers and healers, but scientists, physicians, thinkers, healers, systems engineers, economists, all together. When we think out of that, then you get a whole new type of medical care outcome derivative of this new type of physician.
Well, and the research is a very big component. Tell me about that.
So we've come to recognize that in order to solve the health problems of today and in the future, we need to think beyond the boundaries of our own organization at the Mayo Clinic and reach out for collaborators and partnerships. We have hundreds of partnerships and collaborations, but none are deeper or broader than our collaboration with Arizona State University. So imagine taking the nation's leader in patient care education and research and collaborating with the nation's most innovative university. So right there out of the gate, you've got tremendous, we believe, potential to take the problems of today and deliver meaningful solutions. We have come together and created seed grants investing between our organizations just in the past year, $2.7 million to fund innovations where ASU scientists are working with Mayo Clinic scientists or physicians or both to develop solutions for how does someone who's had an upper extremity amputation sense what their prosthetic limb is doing. We have teams working on that together right now.
So it's very solutions-based.
Yes.
I know a lot of people are very concerned about the rising cost of healthcare. How does a collaboration like this alliance affect healthcare costs eventually?
Yeah, so there's a common misnomer that technology drives up healthcare costs, and we would take issue with that. Now, unfettered, unchecked, unmeasured technology can be a problem with healthcare costs, but what if we actually find ways to leverage new forms of communication, such as the digital communications through video linkages with doctors? It's actually not that new anymore, but what if we study it and figure out how to have meaningful relationships with patients at a distance so they don't have to travel to Mayo Clinic? So we've already deployed some of these solutions through a telehealth network. That's just one example, using technology to actually solve problems and lower costs.
And I think another example I think worth mentioning is that the cost of healthcare is derivative of the late stage in which the clinical apparatus engages the person as a patient. The person should be involved in a lifelong educational activity, helping them to make better decisions, helping them to understand their own bodies a little bit better. Then a lot of diseases before they're chronic, if they can be more quickly identified, then they can be treated at a much lower cost. And so what we have is a system which is waiting for the patient to arrive, as opposed to engaging the patient throughout their entire life. And so what we need is every discipline to be able to do that. Teachers, computer scientists, behavioralists, clinicians, everybody coming together to make that kind of thing happen.
Well, why do you think that has not been happening up to this point?
Well,
or happening enough?
There's a common tendency for medical centers to get locked in silos and work only with those physicians or scientists in their very narrow disciplines. And at Mayo Clinic, we believe team-based care extends beyond our walls to other organizations, other scientists, and the other disciplines. And what ASU brings is the full academic portfolio of all of the different disciplines, from engineers to social scientists to psychologists to business professors and to humanities experts. And all of those individuals bring unique skill sets that can help in a multidisciplinary way, bring very innovative solutions that sitting here today, we can't even imagine all of them.
Yeah, every system we have is a function of the design of the system. Every product is a function of the design. Every design then also produces the people that work within the system. And so because we have not altered the design and because we have not altered who we're producing that's going into the system in terms of how they think, how they're acculturated, how they view problems, how they construct problems, how they think about solving things, because we haven't altered that, we're getting the same outcomes, even some deterioration of outcomes, that is higher costs. So what we have to do is go back and rethink how we produce the people and how we actually structure everything that we're doing, and that's what this alliance is about.
Well, I know that you said that this collaboration really goes back more than a decade. What's been the most surprising thing for you in this entire process so far?
For me, the most surprising thing of working with the Mayo Clinic, and I've been a part of it since the beginning, has been the willingness of the folks at the Mayo Clinic to sit with an institution that's very different culturally and work together with us, and the positive things that have come out of that. New ways of thinking, even the ideas about how the medical school has evolved and other things have been new ways of making things happen. So the most surprising thing to me is that it turns out that what I said about design and people is actually true. You start altering the design, you start getting different outcomes. You start changing the way that people come together, you get different outcomes. And so I've been surprised by the level of the positive nature of the outcomes.
And I would imagine the same goes for you.
Absolutely, and finding two organizations that are as large as we are. So ASU contributes more than $5 billion to the state economy. Here in Arizona, Mayo Clinic contributes $2 billion. Nationally, we're a $28 billion contribution to the national economy. So you'd think it'd be very difficult for these two large and, from an outsider, entrenched organizations to work together. But what we're now putting the name of the alliance on is something that has become actually grassroots, where a professor at ASU can reach out to a physician at Mayo Clinic, and projects are being started every week between our two organizations. So it's really exciting to see.
It's the perfect union. Real quickly, Dr. Crowe, since you're here and we have a couple of minutes left, I do want to digress just a moment, because I know you sent out an email to the ASU community last week talking about and re-emphasizing the support that ASU has for DACA students and Dreamers in general. What's the level of concern on campus right now with students?
Well, I think a lot of people are concerned about how their student colleagues are going to be potentially affected by policy shifts or policy changes. These are their high school classmates who went to school with them in Arizona, graduated from Arizona high schools, were admitted to the university meeting all of our qualifications, and are they themselves here because of their parents' choices. And so I think we have a strong desire at every level of the institution to be as helpful as we can to create an environment where these students can have access to everything that the university has to offer.
What conversations have you had up to this point in regards to whether DACA does eventually end up going away? Have you broached that at all?
Well, I mean, it existed, and then it didn't exist, then it existed, and it might not exist in the future. Our commitment is to these individuals and to these families to help these students to be educated so that they can move forward and be contributors to the economy here in the United States. And so that's what we're interested in. It turns out, interestingly, and I mentioned this in my letter, that the founders of Arizona and the writers of the Arizona Constitution were quite clear when they articulated that every child in Arizona would have access to a free education K through 12, what was, I think, age 5 or 6 to 21, they said. And then they were very clear also that those same children who could be admitted to the university would have access to the university at a price as close to free as possible. And they talked about Arizona being a welcoming home to immigrants, and they talked about a lot of the issues that we face today that they faced then. And so we believe that we are acting in the spirit of the designers of Arizona as a place.
Well, we appreciate you and your commitment, obviously, to the students, so we thank you so much for being here. And also you, Dr. Decker, thank you. And for more information on the Alliance, we should mention that you can go to mayo.asu.edu. Thank you, gentlemen. Thanks for being here.
Thank you.
Tax Credit Tuesday is tomorrow. It's a chance to learn about tax credits that you can take advantage of before the end of the year while helping a favorite organization. With me to tell us about tax credits in general and Tax Credit Tuesday is Chris Jacober, Executive Director of the Arizona Friends of Foster Children Foundation, and Tim Leedy, Director of Business Services for the Balls Elementary School District. Thank you both for being here.
Thank you.
Catherine, thanks for
So
having us.
this is the tax credit team's twist on Giving Tuesday to help Arizona children in need by spreading the word about the Arizona tax credits that are available and the organizations that benefit. You're both part of this tax credit team.
Yes.
How did this evolve?
So it started with a couple of organizations who were tax credit organizations, and we have the common mission of improving the lives of children in Arizona. So, and we also realize that there is a lot of misinformation, just a lot of disinformation about tax credits and not enough information about tax credits. So these members, these 8 organizations.
And how were those 8 determined?
You know what? We asked.
Okay.
We asked people, and we just sort of said 2 foster care, 2 working poor, 2, and so that these 8 organizations are committed to communicating with the people in our donor database and the people that we reach about all of the tax credits that are available to Arizona taxpayers to create a brighter future for children.
And does it surprise you, Tim, that there are so many Arizonans who don't understand just what tax credits are available?
Yes, I am surprised at that because this program has been around for several years, and it started out slowly. It caught on a little bit, but I've been amazed that it is such a robust program for the public schools and all the organizations of why people don't take advantage of it.
It really is a win-win. I just want to mention the 4 different state tax credits that are available. Charitable organizations, qualifying foster care organizations, public school tax credit, and private and certified school tuition organizations. So tell me how your particular organization would benefit. And we should mention that each of these tax credits is a different amount.
Yes.
Why the different amount, first of all?
You know what? That was up to the legislature, and in this last legislative session, they separated out foster care. So we used to be, along with the qualifying charitable organizations, we're our separate category right now. So taxpayers can give to all 4 of these.
Which I don't think they realize.
Yeah.
They feel like they have to choose sometimes.
Right. You don't. You can give to all 4 of them if you have that much tax liability. And for Arizona Friends, it's been a game changer. So, you know, it's no secret there's a lot of children coming into foster care in Arizona. And for us, the demand on what we do, which is help kids in foster care have a childhood, and we pay for music lessons and athletic registration and that kind of stuff, the money we raise from the tax credit has allowed us to keep up with the growing number of kids coming into foster care. So it is critical to our mission.
That tax credit, by the way, for qualifying foster care organizations is up to $500 for individuals, up to $1,000 for joint. Let's go over to the school tuition organizations for a second, because those are different from what you would benefit from.
That's
and that
correct.
is, well, tell me about that. How does it impact you, and what particular tax credit impacts you?
Ours is the public school extracurricular activity tax credit. We're a little bit separate from the tuition tax credit
Right.
organization. The public school tax credit for us is used primarily for certainly extracurricular activities, but a lot of ours is for tutoring. In fact, a majority of it goes to tutoring. We have a lot of field trips for museums. We have after-school clubs, we have math clubs, we have robotics clubs. So anything extracurricular that happens either before or after school, our kids can take advantage of that.
And that public school tax credit, by the way, is up to $200 for individuals, up to $400 for joint.
Right.
And again, people can take all 4 credits.
That's correct.
Do Arizona taxpayers have to do this by the end of the year, or do they have till April 15th?
So they have till April 15th, and that's new for foster care and for other qualifying organizations.
Okay, and that's something most people aren't aware of either.
Right,
They feel
yeah.
like there's this rush
Right.
That's
to do it
correct.
by the end
Yeah.
of the year.
That's correct.
So how are you getting this information out? How are you trying to spread the word?
Well, certainly the Tax Credit Tuesday initiative that we've had has been a push to. I mean, we would like to get the money in before the end of the year, certainly, so that we can provide programs for our students. But they do have the availability now to, as of the law change of this last year, they have the availability to either choose. They can either do it for the tax year 2016, or they can also take it clear up to April 15th for this, and then put it on their 17 tax year if they so choose.
We only have a minute left, but I was hoping maybe you could sort of clear up for people how this differs from a deduction.
So yeah, it's dollar for dollar, and the best thing I can tell you is that my daughter made a tax credit donation, and she didn't have very much money, and she said, I need to make sure I can recoup this. If you have tax liability, you can write your check to the state, or you can write it to a qualifying organization, foster care organization, public school, private school, and it replaces your state taxes dollar for dollar. So, it gives opportunity to a whole bunch of kids who wouldn't otherwise have it, and it gives taxpayers an opportunity to say, you know what, that's what I care about. That's where I want my state tax dollars to go, and they get credit for it.
You make a difference, and it
Yeah,
is a win-win
it does.
situation.
Yeah.
Chris and Tim, thank you so much. Real quickly, if folks would like more information, they can go to taxcredittuesday.org or azdor.gov/taxcredits. Thanks for being here.
Thank you.
Tuesday on Arizona Horizon, hear about a leadership training program for women in Maricopa County nonprofits, and hear from Marsha Mason and Paige Davis, both taking part in the Arizona Theater Company's production of Act of God. That's tomorrow at 5:30 right here on Arizona Horizon. Thanks for joining us tonight on Arizona Horizon. I'm Catherine Anaya. Have a great night.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.